Thank you to Kenneth from Amityville, who works for Con Edison in Manhattan. Thank you to Marissa from East Islip, an RN at Good Samaritan Hospital Oncology Department. Thank you to Pete from Hicksville, an FDNY firefighter and lieutenant for the Hicksville Volunteer Fire Department. Thank you to Alyssa, Patty, and Diana, all nurses who work together at LIJ in New Hyde Park. Thank you to Tony Ann of Bohemia, an LPN who works at a doctor's office in East Islip testing for COVID-19. Are you an essential worker or know someone who is? And we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Children's Hospital, you'll recognize her, to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, we always want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. Well, Long Island remains on pause tonight as the state announces plans to open up a 6th upstate region. There are 10, 6 so far is opening up. The island is among 4 mainly downstate regions that have not yet met the benchmarks to start the reopening. And Governor Cuomo tonight is urging people get tested for the virus. He says the number of people actually taking the test is lagging behind the state's capacity. Now, officials say many sites that used to be appointment only are now accepting walk-ins. So statewide, the number here, let's get the numbers right here. Positive COVID-19 cases, that's now surpassed 350,000. Just unbelievable numbers. NASA Executive Kern also pushing for testing. Today, she says her message is very simple. The more people who get tested, the more we can move toward reopening. And Suffolk County is seeing one of the lowest numbers of new positive cases since the pandemic began. Now, again, let's get to the numbers. On Long Island, more than 77,000 have been confirmed with the COVID-19. Now, statewide, let's look at the death toll. It's just what we don't want to hear, but this is the numbers. The death toll rises to 22,700. Now, county officials say deaths are one reason Long Island hasn't been able to begin the process of reopening. The state metric requires 14 days of declining deaths. Now, according to the latest figures, Long Island has only had 5 straight days. Long Island has lost more than 3,800 people. Those aren't just numbers, those are people. All right, let's get to our discussion right now. Joining us tonight is friend of the show at this point, Dr. Sharon Nachman, the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Thank you so much again for joining us every week that you're here and for everything that you do throughout the week. And I ask everybody this, so let me ask you this, how are you holding up throughout this?
So I've had some good days and some bad days. I was on call this weekend and busy in the hospital the entire weekend. And good news is I didn't see any children with COVID. We were busy. Full new consults, but no new COVID children's cases. Well, and that's very exciting.
Yeah, that is fantastic news. Let me ask you about the idea. I mean, there's been a lot of talk that we're advancing toward a vaccine, or at least we got some clinical trials. Explain where we're at and what that really means.
Clinical trials come in 3 different phases. Phase 1 is just for safety. It's not looking, does the vaccine work? Does it make antibody? It just says, if I gave you the vaccine, did I cause harm? So that phase of trial is very helpful because we certainly don't want a vaccine that's causing any harm. Phase 2 gets a little more into the weeds to understand, can you make an antibody response to the vaccine? Phase 3 is the gold standard. If we gave you the vaccine or we gave you placebo, were you protected? So we are seeing some good information about some studies that are vaccines in phase 1 and they have not caused harm. Well, that's certainly helpful and it gets us along the path, but it doesn't mean that that vaccine will in fact ever prove to work.
Okay, and as you and I were talking before the show, there are lots of clinical trials going on. We got that RNA in London, the bovine study out of South Dakota. There's tons of clinical trials going on with different, I'm assuming, potential vaccines, right?
Right, there are 70 different companies right now that are investigating vaccines to be used for families to prevent COVID. And when I say families, they're looking at all stages, children, adults, elderly, because vaccinating just one segment of the population isn't going to work.
Yeah. All right. Let's get to some of the questions right now. Is this Radhika
Yes, it is.
in Quorum? What's your question tonight?
Good evening, doctor. My name is Radhika Nascimento. Thank you for taking my question. I'm a grandparent with underlying conditions, and I have two grandsons, ages 3 and 7 months. My understanding is the virus is transmitted through fluids from the nose and mouth. If I'm wearing a mask, am I, one, protecting both myself and the people around me? And two, if I do not have a cough or cold and I'm wearing a mask, is it advisable to visit and hug my grandchildren? And if not, why?
So the virus passes not just from secretions, but also from aerosolization. So it may be that your child or you is not coughing. The mask is helpful, but we don't want you to be hugging your children because, as you know, kids are putting their hands in their mouths and on your face and touching you. So while it would be great to say put a mask on and just hug the kids, that does put you at risk because oftentimes children are asymptomatic carriers and they could easily pass the virus from their mouth and their face to touching you on your face or your hands. So the mask is great, and I would encourage you to visit them, perhaps in the backyard, outside seeing them, but certainly not picking them up and hugging them while you're wearing a mask and thinking that would be effective.
Okay. Let's go to Syosset with Nancy on the line.
Oh, yes. Hi. Thank you for taking my call. So my family, including myself, tested positive for the COVID antibodies, except one member who was also sick tested negative. So I was wondering how accurate the test is, and can you retake it? And what does that number the number in the result mean? And should I feel good about having the antibodies?
So the good news is that you've made antibodies, and that's very exciting. It is not surprising that a member of your family who had the exact same illness you did and also probably had COVID is going to be antibody negative. The tests are not perfect. They're not a black and white. They're sort of more like a yes, no, maybe. And we don't know if those who are maybes or no's will turn yes in another few weeks. Timing is also critical. So if you took the test within 3 weeks of your symptoms, it is very unlikely to be positive. Taking it longer than 4 weeks helps us prove that in fact you do have antibodies. So it's too soon for me to say whether the person in the family that tested negative in fact will have antibodies or won't, but I could tell you it's much more likely they did have virus. Unfortunately, we can't prove it at this time.
Okay. Let's go to Merrick, where Neil is waiting. Neil?
Yes, hi, Dr. Nachman. Thank you so much for taking my call. I appreciate everything that you're doing for everybody out here on Long Island and throughout the world. I have a question where I have packages delivered every day, and if the packages were in the form of cardboard or plastic, and plus our regular mail, if the virus is prevalent on either of the substances, will it transmit through cardboard or plastic the same? And do we have to wait to touch our packages 24 or 48 hours later, or should we handle them at the time they're delivered?
So you probably can handle the packages at the time that they come in, because in fact, if they've been sitting out in the air, unless somebody directly coughed on them or touched their face, coughed into their hand, and then touched it, there's not going to be any virus on them. If you're very cautious and you want to bring them in and open them and then wash your hands, that's perfectly reasonable. But leaving them outside for a day or two is probably not necessary. Virus is really not going to hang out in packages at such a high level that if you touch the package, you would automatically get sick. So there's been some data about could you in fact cough on a box and have some virus there? Yes, but no one's really proven after a while how viable that virus is. So I think you're probably safe to bring the boxes inside with your mail, put them on the table, wash your hands and open them, and you should be fine.
Okay. And I think Nina has a similar, around the same similar question as Nancy. Nina, you there? Nina, Massapequa, are you there?
Can you hear me?
I can hear you just fine. What's your question tonight?
Okay, great. Thank you for taking my call and for your service. I've had the classic COVID symptoms and tested negative for the testing and for the antibodies. And I've had fever, pink eye, loss of smell and taste. And how is it possible that I could test negative for COVID and also for the antibodies?
So the answer is it really depends on how well the test was done. Was the specimen transported correctly if they did that nose swab and stuff like that? So we are seeing some patients who, when we swab their noses and we're sure they had COVID, their test is in fact negative. That means that they might have COVID, we just might not have been proving it. But for those patients who are doing antibody testing, again, it's the same issue. These tests are not perfect, and one antibody test does not equal the results you would have gotten from a different antibody test. So don't go from one test to another, rather stick with what you've done if you want to repeat that antibody test in another few weeks. But more importantly, now that you've had the infection, stay healthy, because the last thing we want is for you to get sick again.
Yeah. Let's try to squeeze Lori from Central Islip. Lori, you there?
Yes, hi, how are you?
Doing great. What's your question tonight?
So, I'm a healthcare worker, and my employers are asking the staff to be tested twice a week. How effective is that, and is that necessary?
Oh, doctor?
So I imagine that you are working in a nursing home, and the governor has put out a recommendation that everyone who's working in a nursing home do in fact get tested twice a week. The reason that was done is that we've had a huge amount of our nursing home patients get sick and unfortunately die. So right now the recommendation is to do that nose swab to check for active virus, and if you are in fact positive, not going to work. We are trying to protect those elderly and debilitated patients who are living in the nursing home, because when they do get virus, they are unfortunately dying.
Yeah.
So it's very difficult to get that twice a week. I appreciate it, and I'm very excited that you're able to do it.
All right, we're going to take a real quick break. When we come back, we'll have more expert advice on how to keep you and your family safe from the coronavirus. We always want to hear from you. Call us at that number at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Sharon Nachman, the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Doctor, over the break, I got actually a couple of questions, one phone call and a couple of questions on social media. I was going to ask you this anyway, but dealing with hydroxychloroquine, people are asking, should we be taking that or looking for it as something that's preemptive if you don't have any symptoms?
So there's no data that supports taking hydroxychloroquine to prevent infection. And in fact, a lot of the patients that did get placed on it for treatment had some significant toxicities. At this point, we are not recommending it be part of treatment, and certainly do not want people on it as preventative therapy.
Okay. Okay. Let's go back to the phone lines. Marianne from Oceanside, is that right?
Yes.
What's your question tonight?
My question is, if a person has tested positive for the virus and then they have tested positive for the antibodies, do they still have to wear a mask?
So that's a really great question. And I think it would be best if they continue to wear a mask when they're in public and do the social distancing. Because the last thing we want to do is give people a mixed message. I'm exempt, you're not. Until the governor tells us that we've passed enough measures and we can cut down on the masks or cut down on the social distancing, it makes more sense for all of us to follow the same rules and not think, I'm exempt, I don't have to follow those rules.
Okay, so let me follow up on that, because now we're starting to see about 6 regions, or 6 will be opening up by the end of tomorrow. We're not one of those regions opening up the economies. Should people be concerned still going to the doctor? Should we start thinking about our annual checkups and heading to the doctor's office or heading to the emergency room?
Most of the physicians that are out there are starting to open up their private practices in June. Certainly they're planning. I think someone that does need to go for their routine checkup should call, make the appointment, because the doctor's offices are spacing people out. They do want people to come in, because putting off those annual visits oftentimes means that you're going to get into trouble and we won't know about it. So you're better off saying, okay, June is coming, July is coming, let's schedule those visits, put them on the books, call before you come, make sure you're not sick, and then follow through with your regular doc.
Okay, and just from a medical perspective, when we do start opening up and we're allowed to go out, do you still anticipate us needing to wear masks in public?
I think for the first few months, we probably will. And as the numbers come down and we test more people and they are negative, that means there's more people that are not passing infection, less infection in the community. It means it's going to be safer and safer to get out and not wear masks. We're not there yet, but certainly from the trends that we're seeing now, we are getting there.
Okay. Let's go to Bridget from Riverhead. Bridget?
Yes. I'd like to know how the school system is going to open up with the buses and how they're going to handle having children on the buses as far as 30 at a time, or are they going to have to be inoculated before they get on the buses or before the school starts? Because as a person on the buses, I'd like to know how they think they're going to handle all this.
So I wish I had a good answer for you, and I can tell you both the New York City as well as the Nassau and Suffolk school districts are right now talking about what's their plan of action. How are they going to open? How many kids on a bus? How many bus routes are there going to be? And how are they going to handle the kids in school? Unfortunately, I don't have an answer for you. And part of the reason I don't have an answer is we need to see what the numbers of COVID positivity is going to be in the community, because that's going to drive how lenient or strict we are with wearing masks and social distancing in the fall. My hope is that we'll have so few infections circulating in our community that our kids are going to be able to go to school without masks, and that we're going to be able to go out in public without having to maintain 6 feet. That's my hope. And what we're doing now is definitely driving that ability. By everyone distancing now and wearing their masks, we are preventing virus spread in the community, and that means as that virus comes down, we will have the ability to unmask in the fall. Let's see what happens. The governor is certainly taking a good look at this, and we will be guided by those decisions.
Okay, let's try to get Christina. Are you in?
Yes, hi, how are you? Hi, Dr. Nachman. This is Christina Anthony.
Hi.
My question to you is, me and my husband both tested positive for antibodies. His was extremely higher than mine. Is there a difference in that? Does he have more immunity towards me? And also, is it okay to have someone in my house that tested negative for antibodies?
So let's start with the first part. It's good that you tested positive for antibodies and so did your husband. We are finding that oftentimes men are testing a bit higher on their antibodies than the women. Biologically, I'm not sure I understand that, and perhaps the data is not in yet. So we're going to continue to look at what are the levels of antibody, how high are women making, how high are men making, and then try to understand it. But the good news is, once you've had antibodies, enough is enough, you are probably positive. With regard to bringing someone into the house who you know is negative, that's a bigger question. We need to understand what's wrong with them. Do they have underlying issues? How far are they coming to the house? Are they going to be 6 feet apart? Are your windows open? Do you know where they've been, and are they bringing virus in? We still don't know if it's possible to get a second bout of infection. We are hopeful that people that have antibodies that are high won't get a second bout, but I can't tell you that answer for sure.
Okay, unfortunately, that's all the time we have. Thank you so much, Dr. Nachman. We will see you next week. Thank you for coming in.
Can I give a shout out to my grandkids?
Thank you to all the viewers, and we'll see you tomorrow night at 7.
Okay, have a good night.